We turn to this now. Statistics South Africa's latest data on deaths has revealed that close to 500,000 people died in 2022. In that year, mortality declined by about 21%. The majority of the deaths were as a result of natural causes, and diabetes mellitus and hypertension being the leading disease. Joining us now is Prof. Johan Ferreira from the School of Statistics and Actuarial Science at the University of Witwatersrand. Prof, good to have you, and thank you very much for your time. The highest proportion of deaths occurring among women aged 70 to 74, while for men, it was among those aged 60 to 64. Are we dying earlier than we should be?
Although I think that's a very curious point of reflection. I don't think it is actually necessarily dying earlier than we should be, although the Stats SA report does actually make mention of a curious age bracket where deaths, at the very least in terms of 2022, has been occurring more than what would have been expected for, let me rather say, a more severe elderly individual in South Africa. And it's curious to see that some of these are really based on natural causes in the sense of diabetes, hypertension, like you said before. I also think it's curious to note from the report that we've made a bit of a comeback, if I can use a phrase like that, from the COVID sphere. And I think the public would often think, you know, it's odd that we are only reporting now on 2022 data, considering that it's already close to the end of 2025, where it's important to realize that it's a big, complex structure that is taken into account by aggregating and collecting all of this data and analyzing it in a feasible way so that you reach a point of being able to report on it as reliably as possible.
Yeah. Age of women dying at 70 to 74, men at 60 to 64, maybe not even being particularly specific in terms of age, but from what you would have gleaned in terms of data, is that consistent that women generally live longer, if you would like, based on that interpretation?
Strong statements, of course, made. At the end of the day, I would say the data doesn't lie. And whatever that means in the context of sex or gender, even race in some cases, I think it's curious to reflect on what that means in terms of where our male population and where our female population, especially in those age brackets, usually are. And it's definitely, I would come back to say, whatever the data says at the end of the day, is important to keep in mind that that is where the country is at this point in time.
Considering that the cause of death is non-communicable diseases, when you look then at the spread or the breakdown of numbers in terms of provinces, Gauteng having the highest, the Northern Cape having the lowest, is that just purely by share of population, or is there something else you read into those numbers?
After I've looked at the report and I've reflected a bit on it, I would say the first thing to keep in mind is, of course, population density in an area like Gauteng obviously being a leading cause into not to remind ourselves not to be biased against thinking it in terms of the real numbers. Proportionally thinking that Northern Cape, as an example, would have a significantly less population dense area, population dense area. Would be meaningful to keep in mind that my initial thoughts would be not necessarily something that is related to some unknown or other latent factor, other than the fact that the population sizes and how our country is stratified according to size across these spaces would definitely be one of the obvious reasons why that kind of discrepancy initially would come across.
Yeah, it's not related to, I'm not sure if the Prof would have seen some of these researches that are released sometimes online, where cities where you live longer, and maybe when you're living in the province of the Northern Cape, you're likely to live longer than you would when you're living in Gauteng, as far as suffering from non-communicable diseases.
I mean, I think there's a lot of interesting research that could be done or is being done at the very least on what quality of life means at the end of the day, considering what speed of life would mean in a hugely urban center such as Gauteng versus a much more non-urban environment that the place like the Northern Cape, when you think about air pollution, when you think about speed of living, and what that means for raising a family, what that means for quality of life. There's definitely some interesting factors to be considered and to contextualize a report such as this in that light as well that could shed on that type of argument.
Yeah. South Africa, being a nation at times quite much sensitive when it comes to race issues. But I suppose this particular statistics looks at race, it looks at marital status as well. Looking at the proportions that you're observing there as far as race, what is that indicative of?
It was a very curious reflection, and I think it's it's essential first and foremost to be sensitive for what these numbers mean. And the first thing that I thought of when I was perusing and studying the report was that it does come across, as I said before, the data doesn't necessarily lie. But the fact that Black Africans in real terms seem to be, at least in context of the 2022 report, seems to be greatly contributing to the total number of, as you said, close to 500,000 deaths in 2022. 335,000 odd Black Africans being or dying in that year, where we had about 46,000 white South Africans. And the thing is important to realize that there's a stratification aspect to this that has to be kept in mind. And the report actually makes a point of referring to this also in terms of deaths per thousand, at a rate of per thousand in that population group specifically. And in that case, one can see that the contribution of white South Africans to the total number of deceased individuals in the country of that year is actually around 10.3 per thousand, whereas Black Africans 6.6, and we see 6.4 and 7.4 respectively for colored and other groups as well. So it's important to realize that our real numbers are not necessarily the main thing to always have a look at, but what that constitutes as a proportion of the population group from where it originates from. And of course, for myself, it's always pretty important to realize that even though we might think of this, it's easy to distill this down into a few numbers and into a few proportions, but at the end of the day, if the final report says or claims, 486,401 South African citizens passed away, or at least individuals in South Africa passed away in 2022, it's important to contextualize that those are all human lives, fellow citizens, loved ones. So I want to warn or maybe gently guide the public into reminding ourselves that even though a real number is just a number, proportion is important to contextualize what that means, as you said, in terms of race group, and not to lose sight of the fact that these were all humans that in some way or another were deceased.
It's not argued in any quarters of South Africa, and maybe even outside of South Africa, that there is a real crime problem in the country, and in some instances murder is quite high. But when one looks at this, they might be tempted to say, well, the non-natural causes are not really the biggest contributors to the death number. How do you read that? I mean, KwaZulu-Natal 15.7% had the highest proportion of deaths due to non-natural causes. Gauteng 14.4%, while the Northern Cape at 15.4%.
Interesting point. I realized that many of, I know at least myself, when I was perusing the report, when looking at external causes by itself being defined, at least for the sake of the report, as not natural. External causes including aspects like homicide, suicide, accidents or accidental death. It's quite surprising almost to see that only contributed to something like 13.3% of the total deceased or total deaths of that year, which brings to a real number of around 64,500. And it's important to then contextualize that in terms of reports released by the SAPS, by contextualizing what that means for non-natural or, I suppose non-natural type of causes of death. And it's interesting to view that number by itself in terms of what 64,000 odd deaths for non-natural causes might mean, but also then in the context of in our population, considering 486 odd thousand deaths in 2022, it contributes about 13.3%, which inevitably sheds light on other social aspects such as critical care for either communicable or non-communicable type diseases, or what usually would otherwise contribute towards deaths due to natural causes.
Prof, appreciate your time. Thanks for your intervention and analysis this evening. Professor Johan Ferreira, Professor of Statistics in the School of Statistics and Actuarial Science at the University of Witwatersrand.